Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, here today to talk a little bit about Pravastatin. We're going to talk about dosage and side effects of this common medication. First off, what is Pravastatin? Pravastatin is a medication used to lower cholesterol. It's from a family of medications known as HMG-CoA reductase inhibitors. Basically it inhibits a step in the body that where cholesterol is produced. It's in the family known as statins, often referred to. In the U.S., it's sold under the brand name Pravachol. So what do we use Pravastatin for? Well, it's for high cholesterol or high levels of fat in the blood, hyperlipidemia, prevention of cardiovascular disease, and hypercholesteremia, all basically just saying we're using it to reduce fat in the blood, and that it reduces the risk of cardiovascular issues like heart attack and stroke. The lipid theory is continuing to evolve all the time. They're finding not all fats are bad, not all cholesterol is bad, different particle sizes and things, and so it's always evolving. Statins are still standard of treatment for most people with high cholesterol, but I think this will evolve as time goes by. It'll be interesting to see what studies flesh out as far as cholesterol and what in heart disease and stroke risk. So Pravastatin dosage, usually adults are started on the 40 milligram dose. Children with genetic disorders where their cholesterol is really high, the doctor will often start them at 10 to 20 milligrams a day. Tablets in the U.S. are available in the 10, 20, 40, and 80 milligram, with the 80 milligram being considered the max daily dosage. So side effects of Pravastatin, with the statins, Pravastatin does seem to be tolerated pretty well. It doesn't seem to have as many side effects as some of the other ones. Of course, our common side effects: headache, heartburn, rash, nausea, vomiting, some effect on liver enzymes. So your doctor will monitor labs to, and of course your cholesterol as well as your liver enzymes to make sure it's working and not affecting you. Muscle pain, and of course there are others are possible. What we really want to watch for is that severe muscle pain. You need to contact your healthcare provider right away. If you think that's happening, the sooner the medication is stopped, oftentimes the quicker those symptoms resolve. Tendon rupture can occur, and others such as hair loss and weight gain. That happens in less than 1% of people. But if you think you're having a side effect, be sure to contact your healthcare provider. What about drug interactions? There are a list of ones that we should consider. Fenofibrate and niacin, they're actually used with Pravastatin a fair amount. That can increase the risk of muscle pain and damage. So it's not that they can't be used together. It's just need to be extra vigilant. Let your doctor know right away if you're experiencing any side effects. Cyclosporine can increase the levels of Pravastatin. Clarithromycin, that's a common antibiotic in the U.S. sold under the brand name Biaxin. That can also increase the levels of Pravastatin. Seems to only bother people on the high dose at 80 milligrams. Typically, taking clarithromycin when you're on 40 milligrams or below seem not to be an issue for most people. Colchicine can increase the risk of muscle damage with Pravastatin. Colchicine generally used for gout flares. Gemfibrozil, we'll also see that used a fair amount with Pravastatin. Just need to be mindful that it can increase the risk of side effects, and you'd want to report that right away to your doctor. Red yeast rice, that's a supplement. It acts in a similar fashion in the body, so that just because you're taking two medicines kind of doing the same thing in the body, that will increase the risk of side effects. I appreciate you watching. Remember, always talk to your healthcare provider. If you're having any problems or if you think you're having side effects, I'd appreciate it if you'd subscribe to my channel. And if you have any questions, if I didn't cover what you wanted to know about Pravastatin, please ask in the questions below and I'll try to answer it for you. Thank you.